For me personally, it was a wonderful opportunity. I loved it. I really enjoyed it, but also it refreshed me. You know, I was getting to the point in my job, I was maybe getting a bit stale, going away to do something different. I came back with a real new enthusiasm for my current job. And I learnt a lot about consultation, participation, which I was able to bring back. And I also learnt how fortunate we are in the NHS. Not just because we treat patients so well and we've got great facilities, but we're a very strong organisation on equality, on gender equality in particular. And so I realised what a huge advantage that was working in the NHS. But I came back energised and rejuvenated and ready to work harder again.
Coach, healthcare delivery in Zambia as opposed to the UK is so different. And one could be forgiven to think that professionally, well, there's nothing much I can learn, I can only contribute something, and how wrong is that as an attitude? There's so much I have learned really from my involvement there.
I've always encouraged midwives to work internationally, and over the last 6 years in Malawi specifically, I've probably worked with between 10 and 15 different midwives on different projects. And the reason that I encourage them to get involved in this work is that it's not just about them utilising their knowledge and skills in that context and making a difference to individuals, communities and the country. It's about the opportunity that they have for their own personal and professional development. And those transferable skills that they can take back to an NHS context are invaluable.
From my own experience, it was a fantastic, life-changing experience. And being able to go across there and find a hospital which had no running water at all, and end up with a situation where 90%, as we've said previously, that and to see the smiles on the faces of the people when they saw the taps working was absolutely fantastic. And certainly I gained a lot out of that personally.
And I guess the bit for me is that bit about what we take for granted here. You turn on the tap and it runs, and you switch on the light and it comes on. Yeah. And we don't have a sense of how important that is to the outcomes of patients in this country. Whereas there, we were very quickly able to see how the lack of those services could actually result in the death of patients, or the real negative outcomes for patients. So I took that away, A, how much we take for granted, and B, how important infrastructure and estates and maintenance is to the NHS.
Getting time off to volunteer can be challenging. I think you need to be flexible and willing to compromise. And it also helps to have extremely supportive colleagues and friends and family for you to do that. So in many cases I do it in my own time, in annual leave for example. However, when I went to Sierra Leone I had to request time off because the total commitment was 10 weeks, and that was difficult. And if I swap hats and look at it from a manager's perspective, I can understand that there were a number of risks and challenges for them. However, when it comes down to it, it boils down to three things: staffing, finance, and political will. And what I would say is that the 10 weeks that I was allowed to go was incredibly beneficial for myself, but also brought a large number of benefits to the organisation.
Yes, I worked as an honorary visiting clinical lecturer, so I had a large clinical workload consisting of theatres, clinics, ward reviews, and as well as helping with medical student teaching. There was a huge amount of pathology. That I saw cases that I would never see in a lifetime's career working in the UK. But on top of that, there was also learning around the managing to work with people from different cultures, and not just from Malawi, but from other doctors or people that were volunteering from other parts of the world. And that was a fantastic bit of personal development for me.
The key thing about this twinning arrangement is that it was always set up as a mutual educational process, and the idea was that both institutions would receive educational benefit. And I'm sure, and there's no doubt that the people who've gone from the Children's Hospital to Lahore have always come back with fresh insights into the way they deliver healthcare here. In particular, it just allows you to understand priority, to really get a sense of what the essential bottom line is in terms of delivering healthcare. It really concentrates your mind to see other institutions working under such pressure with such grace and with such skill that it really makes you think.